So if we talk about the oncology, what is the most challenging surgery that you feel?
I operated on a young child around 10 years who had developed cancer, but majority of people told your entire limb has to be removed.
Once the cancer has come, after they got treated and they are now doing well. So any changes happen after that in the food, lifestyle or sleeping behavior?
Especially like red meat, where the chance of intestinal cancers are more. And again, if you are having overweight, you'll have to get down your weight. See, obesity is becoming now one of the risk factor for cancer.
Oh.
And India being now we are again being as diabetes already we are capital for world capital for diabetes. So now in obesity we'll be again leading in future. So only 10% of cancers are genetically mediated. Rest 90% of cancer are sporadic. Like as you grow on, there are genetic changes in the body which causes cancer. Out of this 90%, 50% are due to our like habits, addictions, and other lack of healthy lifestyle.
So early detection can be curable.
Yeah, definitely. Even if you see the famous actress Angelina Jolie who has come because she's again BRCA positive family. Even before she got cancer, she got operated on a broad breast. So even before cancer is diagnosed, you can get your treatment. And early detection definitely is like the quality of life, the amount of treatment you get is less. The quality of life is very better, and you have cancer-free life for long period.
Yeah. Dr. Mahendra Verma, sir, first of all, thank you so much for your valuable time, sir.
Yeah, thank you.
So, welcome to the Healing Arts. So, shall we start, sir?
Yeah.
Yeah. So, understanding the advanced like cancer surgery, sir. First, I would like you to explain that so that our listener they will understand about the cancer and about the method of surgery.
Yeah, regarding cancer surgery, like what it is different from the regular surgeries. Only thing in cancer surgery, it is not only you treat where the tumor is there. Like example for breast cancer, you don't treat only the part where tumor is there. Along that, you operate in the axilla also because every cancer has spread to the lymph nodes. So we'll have to do lymph node dissections. Either it might be different type of cancer, different locations, and cancer or it is more challenging because the amount of surgery required to the patient will be more, and are very difficult procedures for operating also. That is the reason that advanced cancer surgeries in abdomen surgeries where like tumors are very large or in patients where limb preservation is required because it helps the quality of life of the patient is different for them. So in these patients where you plan adequately and do things prior like with adequate imaging and everything, we can give good quality of life to the patient. At the same time, we can treat cancer completely.
So, basically, why does this happen, sir?
So if you see like out of like causes of cancer, the different types, out of the major like 50 to 55% of the cancer is caused due to whatever our habits. Like it might be either smoking, consumption of alcohol, or majority tobacco chewing or betel nut consumptions. And other things add on is the or lack of healthy lifestyle. We don't do a proper exercises regularly and consumption of more of outside food, adulterated foods happening. Only 10%, like out of 100 cancers, yeah, only 10% is because of the genetics that like from family, like someone if a mother is affected with breast cancer, the next generation either daughter getting breast cancer is there, or in males in case of a lung cancer is there is chance that next generation gets. So only 10% of cancers are genetically mediated. Rest 90% of cancer are sporadic. Like as you grow on, there are genetic changes in the body which causes cancer. Out of this 90%, 50% are due to our like habits, addictions, and other lack of healthy lifestyle.
So, is it just because mother has the breast cancer? So, is there any chances for having for male also any
Not only like
possibility?
we have to see that there'll be multiple factors in it. What age the mother has been diagnosed with cancer, whether she is diagnosed with cancer at an early age, like from now the cancer, if you see in India, it is coming down even to 30 years, 25 years, people are getting breast cancer. So if like such early age they're identified, then we do a genetic testing in them, like what you call as a BRCA mutation is there. In case genetic testing comes positive like BRCA1 or BRCA2, then there is chance we'll test the next generation, either it may be son or a daughter. Both of them we test them. In case if it is positive, they'll definitely have the risk of getting cancer in future. So normally we do like if a person gets cancer at 40 years, say a mother, for the next generation we ask them to start screening at least 10 years prior, so that from 30 years onwards we ask them to get your screening done, so that we can diagnose, in case there is something, we can diagnose cancer very early and treat them completely. In patients who are having this genetic testing positive, even before they're diagnosed with cancer, we do a prophylactic surgery, so that even before cancer comes we can prevent getting of cancer.
So early detection can be curable.
Yeah, definitely. Even if you see the famous actress Angelina Jolie, who has come because she's again BRCA positive uh, family. Even before she got cancer, she got operated on a both breast. So even before cancer is diagnosed, we can get your treatment. And early detection definitely is like the quality of life, the amount of treatment you get is less. The quality of life is very better, and you have cancer-free life for long period. For breast cancer diagnosed early stage one, you can live up to 25 to 30 years without any recurrence, means any side effects, or quality of life will also be better.
So what is the kind of symptoms we can say, so that the people they will be aware, okay, there is something like unusual, so that I should go to the doctor and
So
do the
again,
other check.
different cancers present with different symptoms. So any symptoms like breast cancer, say example, they may present with a lump in the breast or any nipple discharge. Similarly, in case of any intestinal cancers, you present with altered bowel habits. Like sometimes you may have constipation, sometimes you might have loose stools, you might have blood in your stools or blood in urine for urinary malignancies, or even gastritis and upper abdominal pain, symptoms not subsiding for long periods of time. You are having unintentional weight loss, that your appetite has come down significantly, you are going down weight without you intending to lose weight. So these are all features when you have, definitely you'll have to meet your physician nearby or whatever doctor you know nearby. Get the regular checkup done, whether it is there something or it is only because of any other condition. So once you get symptoms, meet your doctor nearby, so that you'll know what is happening with you. Based on that, we can evaluate further if required. If everything is normal, it is only a benign conditions which is not going to spread, then only single small treatment will be sufficient for them.
Okay. The symptoms, it seems like very, very common, like in day-to-day life.
Yeah, that will.
There are many people who is, I mean, facing this like a weight loss or too much weight gain. So they think generally like kind of like thyroid or something has happened. So straight away they go to the doctor and do the thyroid test.
Yeah, so same thing. As I told you, like if you're getting symptoms like you're losing weight without I'm saying unintentionally, like without your intention to lose weight.
Yeah.
Once you meet a physician, if thyroid profile is abnormal, then we can tell it is because of your thyroid you're losing weight. If it is thyroid is not abnormal, it is not high, only it is thyroid is normal. In those patients, we need to evaluate further. So sometimes a simple CBP, complete blood picture, may be sufficient to tell that
Okay.
you're not taking nutritional properly, or you're having some iron deficiency anemia. So you have to increase your oral intake or increase your feed. So that time, that one thing might be sufficient. A simple thyroid profile may be sufficient. Instead of we thinking like something is happening, and few people without out of anxiety, they might not meet the doctor until it is too late. So better just meet a doctor. He might advise you a few simple tests. If there are normal and still there is something abnormal in your body, then there might require some additional testing.
Additional test. Okay. So if we talk about the oncology, what is the most challenging surgery that you feel?
So there are like different, like very challenging surgeries. Like in oncology, if we call it, might be lung cancer related surgeries, or in case of abdomen, liver surgeries are very complex surgeries, or we call it as a pancreatic surgery, we call it as Whipple surgery, in which we like the chance of having patient like post-operative complications are high,
Yeah.
intraoperative blood loss might be high, and there is chance that 30% of patient might have some type of morbidity that they might have to stay in hospital for long days. They might require multiple tubings in their body. So these are different complex surgeries. And again, liver surgery is one thing, where once we remove the liver tumor, how much of the remnant liver, how is functioning, again depends on his underlying liver condition. So some might, even after doing surgery removing the tumor, they might end up with what we call as post-hepatic liver failure. So in
Okay.
those patients with India, still organ transplantation is not still very wide up. So still in those patients, they might have like, there's one chance of like death in few patients, like about 5% to 10% of them. There is chance that even after removing that cancer, the post-operative period they may not survive. And
Mhm.
again, in ovarian cancers with stage 3 disease, where it is spread to the abdominal cavity lining, which requires a major surgery, we'll have to remove the complete tumor and again give chemotherapy during the surgical time only. So there are multiple advanced surgeries, complex surgeries in oncology. It is slightly different than the regular surgeries because the amount of radicality or resection is very high compared to the regular surgeries.
So what is the percentage we can say, like in India it's very high because of this lifestyle?
No, in India, the incidence is increasing. That might be because of the advanced diagnostics tests now available. Now more people seeking like help with doctors. Like if they get symptoms, they're coming to the hospital or even clinics and getting the checkup done. And we being more of a populated country, our incidence looks more compared to the other countries. Because if you see the middle-aged population between 30 to 50 years, we are almost highest among the world. So in
Mhm.
those, if you count the number of cancers, it will definitely be higher. It doesn't mean that we are we are like we have become a cancer hub or anything. Yeah, definitely cancer is increasing because of age, younger age group, number of population is more, and similarly addictions and other things. We are getting used to westernized lifestyle
Right.
compared to previously, where we were more of hardworking and our diet used to be not more of homemade food. Outside food was consumption was limited. Addictions were less. Now with more addictions and change in
Right.
lifestyle, yeah, incidence is increasing. Yeah, in future it will again now significant. There is increase in the number of cancers.
So you say lifestyle that also include the sleep, like because
Yeah, yeah.
nowadays the shifts, it has become because of the US shift, any other
Yeah,
shift
see
generally.
again, how sleep affects is because of the stress. So once you feel stress, again, what you call is an inflammatory process in the body. So when your body gets into inflammatory process, there is release of free oxygen radicals. So that free oxygen radicals, when your body cells, once you are growing up, few cells die, few new cells comes. So when this change is happening, when that free radicals might damage your DNA, which might cause some mutation in your body, and it might lead to cancer.
So this surgery, like generally, how long this takes, and what kind of surgery it is? It is like minimal invasive surgery. Generally, it happens, or you go for the open surgery as well.
So again, depending on which type of cancer we are operating and where in the body, like minimal invasive surgery, majority of cancers we are doing minimal invasive now. Like it might be whether intestinal cancer or female gynecological endometrial cancer or cervix early cancers, even liver cancers, even pancreatic cancers. Now, initially it used to be very big incisions from completely abdomen we had to open. Now with only few like 1 centimeter, 1 centimeter ports, multiple ports. So we are doing laparoscopically. Now with advancement, we have got robotic technology. So even with robotic technology, we can do the same thing. Only thing again depends on what stage the patient is and how much is the tumor and all, whether it is feasible for minimal invasive. It is not that patient is not feasible for minimal invasive, but you want to do it, you can do it. So you'll have to choose your patient, which patient is better for what procedure and which patient is not. It is not. So based on that, you can give good outcomes to the patient. Even see the amount of surgery, whether you do open, whether you do laparoscopically or robotically, the procedure is same. Only thing, the amount of incision cut pain will be more in open surgery compared to the minimal invasive. So whenever feasible, when required, we offer them laparoscopy or robotic based upon their uh, whatever financial things they are think. Otherwise, if they are not financially fit enough, if they think this patient we can't do minimal invasive, we offer them open surgeries.
Okay. So what is the most challenging part when you talk to a patient?
The most challenging part for them to accept that they are diagnosed with cancer. So because once they heard the term cancer, they feel it is a death sentence, that everything is done today, like we are not going to live long. But it is not the case. So for them, we'll have to tell them that every cancer has certain number of stages.
Right.
So your cancer is diagnosed at so and so stage, there is definitely cure for your cancer, but we have some form of treatment will be there, and so treatment are the options you're having. So again, side effects of chemotherapy, they feel like I might lose hair, my color might change, I might become very weak, so I might get vomitings or other things. Again, surgery pain, they might think very big surgery, the risk to life might be there. So these are all things we should counsel them. And not only these things, once cancer is diagnosed, not only the person who is diagnosed with cancer, their family members also think like cancer means even they will get cancer. Or even if you touch a patient, if you eat along with them, or you sleep in a single bed, cancer is
There
transmitted.
is nothing like that.
They're all myths. People, like, still, because uh, in India it's more of what hearsay.
Yeah.
It is more than what the doctor says, what the other people in the
Yeah.
society tells, that is more believed. So that slowly people are getting now understanding more availability of technology. Now you can Google what is there, so how it is happening, what are the more cancer spreads, everything is there now. Once a little educated, able to read few basic things, then you can tell that yeah, this is the how treatment goes about. And nowadays you can't hide treatment. Whatever any guidelines you want, how cancer, each stage wise treatment, everything is available for you. So always everything, whatever we tell them or we guide them, it is according to the guidelines. So take initially counseling takes large period of time for them to make them understand what cancer is, why it has come to them, and how to get about treatment.
Once the cancer has come, after they got treated and they are now doing well. So, any changes happen after that in the food, lifestyle, or sleeping behavior?
No, see, initially during treatment they'll have some discomfort, either during chemotherapy or during radiation or during surgical time, like maybe because of little pain or side effects of the chemotherapy or side effects of radiation. Other than that, once they complete the treatment, initial few months they'll have little time to cope up with all the treatment related things which a body underwent. Once they are fine with everything, they can lead a normal life. So there won't be anything that no need to eat those things or no need to cut. Few things you'll have to cut down,
Right.
especially like red meat, where the chance of intestinal cancers are more. And again, if you're having overweight, you'll have to get down your weight. See, obesity is becoming now one of the one of the risk factor for cancer.
Oh,
And
okay.
India being, now we are again being has diabetes already, we are capital for world capital for
Right.
diabetes. So now in obesity we'll be again leading in future. So we'll have to get down our weight, do a regular activity, exercises. Other than that, rest of the things, the way you lead life is normal. Whatever work you're doing, you can do the every work you're doing, the regular activities, meeting your friends, your job, or whatever profession you're doing, you can continue with everything.
So, mentally also, they need to be very
Yeah,
strong in that.
yeah, mentally, yeah, they'll have to be strong. Once they're cured, slowly, once everything is treatment is completed, slowly by 3 to 6 months, they'll get, yeah, used to like the normal back life. But during the treatment, they'll have to be mentally strong, and they should have strong family support. It is both psychological and family support. Once your family is supporting you, it will in turn lead into your mental stability to yourself.
Okay. So, what is the cancerous food we can say? Like as you mentioned, red meat. I mean, is it like very dangerous to have the common
Not
people
dangerous.
also?
Like only thing is like see, there are different types of food. Like you see, if you go outside, when you see like this kebabs which are charred, not they are burnt very deeply. So when you burn anything to the like a dead tissue become very black and everything. So they contain what you call as oncogenes in them. So
Okay.
so because your burnt tissue is there, when you consume those things, your body again intestine absorbs few of them. If you're lucky enough, you might not get one. Sometimes if you're unlucky, you might get that. They might lead to a mutation in your body. So
Okay.
again, red meat, there is chance of intestinal cancers, especially large intestine cancer, for consumption of, not like if you consume once in a month or twice in a month, or anything, but few of them who are meat lovers or meat eaters,
Regular there.
yeah, they eat red meat on a regular basis. So because sometimes the meat might not be cooked properly.
Hmm.
When meat is not cooked properly, there is chance that some improper cooked meat, there is high chance that you might develop cancer because of those things, especially intestinal cancer. Again, same thing, more of carbohydrate food, rich in fat foods. They don't directly cause cancer. They indirectly cause cancer. Again, obesity is one thing, diabetes is one thing you'll get, lack of physical activity, increased fat diet, increased carbohydrate diet. So immunity in body goes down. Once immunity in body goes down, there is chance that you have a mutation. Once the mutation takes place, then a cell undergoes uncontrolled growth. It will lead again into cancer.
So that's why I've heard in my home also many times. Don't uh, burn the rotis or chapatis directly on the flame.
That is okay.
So is
Again,
that
same
also
thing.
one same?
Uh, don't make it like charred. You can do burn directly, nothing, not much happens, but don't make it into charred thing. Sometimes you roti thing, but sometimes maybe in restaurants, if you see like the corners are completely burnt
Burn.
out.
So that things are not good. I mean,
Yeah, no, I did not good. See, once in a while, not much, but on a regular basis, if everything you're eating is burnt food, especially more than chapati, I feel it is more of meat. If you see in kebabs and all everything, if you see about outer layer, everything will be burnt charred.
right. That is very
That
dangerous.
is, if you eat for more number of times, the chance of like you might future you might, or it's not that definitely you will get cancer. It is a risk factor.
Now I'll be very conscious because I didn't know about this earlier. It's a really new thing for me, as well as I think for the listeners also.
Yeah.
And most of the patient, like they're very scared about the post surgery part. So any advice you'd like to give them?
Yeah, see, majority like in cancer surgeries, like the complications are like no, the complication rate has come down with advanced like procedures or advanced like whatever equipment you're having. So there is nothing to worry regarding what are the post-operative complications you're having. Yeah, initially 1 2 weeks of surgery depends on what type of surgery you underwent. Few cases you might need to stay in hospital for 1 day. Few cases of surgery might be required to stay for 10 to 14 days. After surgery, after discharge, it will be minimal discomfort. So whatever majority complications happen in this or in major cancer surgeries happen during your hospital stay. That it might be initial 1 week when you're staying, it might happen that time, or initial 2 weeks in major surgeries. So once your initial 30 days of your after your cancer surgery are done, the complication rates are like minimal. It might be only 1%.
Okay, so there are chances like after post surgery also.
Yeah, basically, see, no surgeon or no doctor wants to wantonly harm you anything,
Right.
but each patient's anatomy is different, and each patient itself is a complex anatomy. So when you're doing surgery, you might inadvertently, maybe the stress of surgery cause few patients, because of their age, because of their diabetic profile or hypertension, they might not tolerate a major surgery, or few inadvertent injuries during surgery which might lead into a post-operative complication later after maybe 3 days or 5 days, which are not recognized during surgery or which might come up after few days after surgery. So definitely, yes, surgery there'll be a risk, but if your well planned surgery is properly planned, properly taken care, the mortality or like death first from surgery, it will be like around 1 to 2%.
Okay. Okay. So looking ahead, what do you see the future of the cancer?
See, the cancer again, incidence of cancer is definitely increasing. Not only in India, the world around, the cancer is increasing. So one advantage I have, like not India, still research is not very significantly higher in India, but very good things are happening in new research in maybe Western countries or other countries. Is the form newer drugs are coming where the lifespan of patient is significantly increasing. Maybe you can see example of Sanjay Dutt, where he's diagnosed with lung cancer stage 4. Ideally, maybe few years prior, if he were diagnosed with lung cancer, his lifespan would have been 6 months to maximum of 1 year. Now with treatment, new advancement, drugs coming, everything, he is completely free of cancer and is living a normal life, doing back got back to his acting career again. Similarly, patients now regularly who we treat, it might be lung cancer, now they're living for 7 years, 8 years, stage 4 patients I'm telling. So which is very significant. And again, in regarding surgical things, where previously cancer surgery was very morbid, now
Yes.
with advancements, it may be robotic or in sentinel lymph node biopsy, where we call, where we decrease the radicality of lymph node dissection. Again, ICG, there is one more diet we try to minimize the complication using those things. And again, robotics with 3D vision, advanced use, and the maneuverability of the robotic arm, even the complex steps during surgery or where we expect it is difficult, it has now become easier now. So
Yeah.
definitely incidence is increasing, but definitely cure is coming for like even stage 4, we are increasing your lifespan to significant amount. Again, breast cancer, thyroid cancer, 20-25 years, completely cancer free life. So yeah, significant improvements in all aspects. Now radiation also, now with newer machines compared to previous machines some 15-20 years, where once you give radiation your skin get burned, complications of radiation are more. Now with advanced radiation machines, like now we have MR Linac here, though that again it is an advancement where you give targeted radiation therapy. There is one more called as proton based radiation treatment, where side effects are very minimal.
Okay.
So significant advancements are there in healthcare, and people are recognizing that yeah, cancer is requires a lot of healthcare. Maybe changes, innovations are required.
So do you think like India has reached up to that level where the treatment
Yeah,
is
treatment, we are no less than the Western countries or the Americans. So what treatment aspect is same. No,
okay?
not guidelines are same. Only thing difference between us and them will be the availability of drugs. Few drugs which are very costly here, we'll have to import from few European countries or thing, that is still not accessible for a common man. Like one drug might cost 2 to 3 lakhs. So only few of them are affordable. But regular drugs, same treatment, chemotherapy, same surgical. We do equal work with what we do in the Western population, like that might be US, UK, Australia, on which country you go. The same work we are doing as they are doing. So there's not of difference. You might be, maybe the type of surgery is same, radicality of surgery is same. I might tell like even we are doing better than few of the US counterparts or European things. Yeah, maybe Japanese and Chinese are slightly ahead than us, but definitely we are on par or better than US and UK counterparts.
Right. Well, thank you so much, sir. Before we wrap up, we'll have a quick, like rapid round of questions. In few words, you can
Yeah,
answer. I'll
yeah,
be asking few questions. Let's. So are you ready?
yeah.
Okay. So, what inspired you to become a cancer surgeon?
So again, I saw like different people operating, and I felt it is the most challenging thing. So I felt where we can give good quality of life to patients. So it was inspiring for me, where it is different than the regular surgery, where I can relieve pain of like lot of like different cancer patients and give them support both in way of treatment and also in like psychological support to them.
Your most memorable surgery?
Yeah, like there are quite few. I operated on a young child around 10 years who had developed cancer, but majority of people told your entire limb has to be removed. But we, without removing the limb, we preserved his limb, and he is walking with support.
Oh,
They are there. And different surgeries when we operate on a 72-year-old patients where we have done Whipple surgery, that is considered one of the major surgery in the abdomen. So we are operating on 80-year-old rectal surgeries, an oral cavity. So different, there are multiple, like maybe quite few memorable surgeries.
so there is no age bar.
No, again, cancer, there are different type of cancers. So it might affect even a 6 months or 1 year old baby to about 90
6
years.
months, 1 year old baby.
Yeah, there are different type of pediatric malignancies. We leukemia, lymphomas. There are solid tumors like Wilms tumor in kidney for children are there. So again, varies from person to person.
Okay. One myth about the cancer surgery that you want to
Yeah,
debunk.
the major myth I want to tell, by doing surgery, cancer doesn't spread. So majority of people think when we do put a needle or biopsy or doing surgery, we handle cancer till the cancer spreads. No, by doing surgery, we remove the entire cancer which is visible in your scan, CT or a PET scan. So we remove 100% of cancer that is visible on an image.
Okay. A book every doctor should read.
So there is not a single book where doctor reads like for cancer treatment. Again, there's a basic book called as Devita. But again, for you to understand the recent advancement, the changing treatment options, you have to what you call as different guidelines are there, and again different publications. Like there are different publications, research work being published. Based on that, where there is good research, we try to take information from them and apply to the patients.
One innovation in the surgery you're excited about.
And the main thing I meant tell is the robotic surgery, where the new robot advancements have come now. With few of them, Indian-made robots have come. Again, there is one company called as Da Vinci, where they're coming with a single port robot. Now they are already in Europe. I think few of them, few centers have started. Maybe if that comes up again, surgery, it might be only a very single incision surgery, which again the robotic arms open up and again the same amount of surgery is done inside. And again, different other aspects of treatment regarding decreasing the morbidity of surgery are also coming. Maybe yeah, there are multiple innovations which are happening. Maybe in future, the surgical morbidity might also come down.
The single port means one port will
Yeah,
happen in that the
yeah. Once there'll be
camera and
only
everything
one
will get spread.
incision in your body instead of multiple small holes. Once we put, it will be like a bigger size tubing like thing. Once you go inside, again because of the new fiber technology whatever you're having, but again arms open up. There'll be one arm for the camera. To other list of the three arms will be for the surgical part.
You go to stress buster after long surgery.
Again, once long surgeries like maybe after surgery, I prefer to have some peace of mind, rest separately for about half an hour time. Yeah, in case like very long surgeries, when I feel like I want to eat something, my preferred will be a dessert.
Online, which is online.
Yeah, ordered online.
Your piece of advice you always give to your patient.
Yeah, same thing. Don't fear about cancer. It will not kill you. Once you're strong, positive, definitely beat cancer, and you can lead a good quality of life. And again, once you're very strong enough, there is nothing that can beat you, and you'll come out. Yeah, during treatment, some hiccups will be there, but definitely once you're strong, you'll come out better.
One thing every person should do to reduce the cancer risk.
Same thing. Addictions. Stop smoking. Stop consuming alcohol. No tobacco chewing. No betel nuts. Nothing. Stop everything. And again, at least have an activity of daily half an hour to 1 hour. Some form of physical activity. At least you work like 200 to 300 hours a week. If you're doing activity, that will be sufficient for you to lead a good quality of life.
A famous doctor or scientist you admire.
Think a lot of famous people I admire, like from Indian perspective, I can tell APJ Abdul Kalam, CV Raman. I'm in the field of maybe science and physics. They are there. And personally, for me, more than people of one particular famous doctor or famous scientist, I would prefer my teachers who had taught me, who had inspired me to develop into a cancer surgeon. And whatever skill I've acquired is because of their interest or their training I had. So people who I know, I prefer them to be more famous than people who are really famous.
One word to describe the future of cancer treatment.
Yeah, there are multiple advancement, multiple new drugs coming up. So definitely, even stage 4 cancers, majority we are still getting cured. Few of them are getting cured. few of them are living a good quality of life for long periods of time. So yeah, research is one thing, and again in new innovations multiple things are coming up. Yeah, maybe once all things in, maybe in India, if research is increasing, the cost of drugs might come down significantly, and we can give for all, not irrespective of the financial status of patients, we might be able to give the newer drugs to the all patients. We can give maybe good quality of life to them and better survival.